All right, let's just go ahead and we're going to bring on Dr. Ho Wen of the Physicians Advisory Group, and then he'll be joined momentarily as they're figuring out the technical issues at the Guam Memorial Hospital. He'll be joined by Dr. Joleen Aguon. Good morning, Doc.
Hi, Doc.
Good morning, Chris. Good morning, Sabrina.
I just guess right off the...
This is a sad weekend.
Yeah, and a lot of people are wondering about this, the tragic loss of this 10-year-old boy as a COVID-related fatality. And I know it was Naval Hospital, Doc, and we kind of put in the communication with them. We haven't got anything back yet. So is there anything else that you can tell us about this 10-year-old boy who passed of COVID relations over the weekend?
Yeah, we don't have any information either come out with Navy, but, at 10 years old, there's not much comorbidity there, except if he's have asthma or diabetic, either one. But we don't have any info come out Navy. But, it's sad, and that just a young life lost there. But, again, this virus here does not discriminate against anyone. When it's an age, need to pay attention to make sure to protect ourselves and our family. But yes, this is going to create a lot of weight in the community for the parents to worry about. So we're going to try to get some info from the Navy, but probably public health probably the only one that probably will get the info out for the public. But again, parents, you still have to really pay attention to your children. That's why sometimes we ask that if you go shopping somewhere, just if you have two parents, just leave the children at home and don't bring them along. We still see that in the community, just like Mayor Savara say, just stay at home, go shopping by one parent, just leave your children at home.
Okay, and I think we now have Dr. Joleen Aguon up on the KUAM News Zoom room. Dr. Aguon, can you give us a 1 2 1 2?
1 2 1 2.
Awesome.
You hear me?
Yes.
We can hear you. Yes. Welcome to the show, Doc.
Thank you.
And I guess we'll just ask you because we had just asked Dr. Hoa. Do you have any additional information about this 10-year-old boy who passed over the weekend?
I don't know what sorry, I missed what Dr. Wen had said.
He said
I didn't hear anything.
He didn't really know anything else, so we're just asking you.
Same. The only thing I do know is that patient, he was transferred to Naval Hospital.
Was he
not to GMH?
Oh, so he was. You said transferred? Was he transferred from
he was transferred from home to Naval Hospital.
Mm-hmm. And do we know he was I guess a dependent, I guess you could say?
I have no information. I apologize.
Okay. Doc, so I mean we have a lot of parents. I got a 9-year-old turning 10 next month.
I have a 10-year-old.
Right, and parents are this news just hit hard, so hard. I mean it's one thing, and I don't want to be that. I'm not that guy to be like, oh, we've had 95-year-olds pass, but it just hits. It just hits different with a 10-year-old boy. So what would your message be to the parents out there, doctors, who are waking up this morning and wondering how real the risk is for their children?
The risk is real, whether or not you're a child or an adult. I don't know. I saw that on the JIC he had some comorbidities. The only, the one underlying comorbidity that children can have is asthma. So if he had asthma, it could exacerbate his asthma. Asthma alone, without any underlying infection, when they go into exacerbations, is dangerous by itself. So, if your children are sick, for sure, please bring them in, have them seen either by their primary care physician in the urgent care, within the emergency department, especially if they have underlying lung disease or, a history of asthma. I can't tell you, what may have happened with this child because I don't know enough information.
Right. So for the Guam Memorial Hospital, though, are you seeing an increase in children coming into GMH, and
No.
as a result of COVID? No.
No.
Or okay, any children coming into GMH?
Currently, we've had children come into GMH that were positive. They have not stayed long. Usually they're seen by the pediatrician and sent back. We haven't had any hospitalized, nothing recently, my understanding, of COVID positive pediatric patients.
Doc, there's a lot of kids out there with asthma. There's a lot of kids out there with.
There are a lot of kids out there with asthma.
So what are we saying to the parents out there? Because I just know that they're having a rough morning.
I would practice your infection control. You know, wear your masks. Teach the children how to wash their hands. Social distancing. I mean, in the home, you know, limiting the amount of people coming in and out of the house if they're not immediate members of the household. You know, if your children, and I'm not a pediatrician,
Right.
know,
Right.
yeah.
but you know, if your children are coughing, you know, having fevers, please contact your pediatrician or bring them in for sure.
What other and
Also get
Dr.
the
Ho-
flu vaccine.
Right, I was just going to
Yes,
say.
get vaccinated for sure. We are already seeing cases of influenza since about a month ago. So influenza is on this island, and I know that some of these clinics already have the vaccine available. So please get vaccinated.
Docs, what other types of conditions in children could lead them to have a hard time with the COVID? Because we heard diabetes, right? And I know Dr. Was talking about obesity, and obesity being a factor in how well some adults do against COVID-19. And God knows we have some chubby kids on Guam. I mean, for lack of a better way to put it. So what other types of condition other than asthma?
Again, I'm not a pediatrician, but the comorbidities of adults, such as morbid obesity, yes, for sure, especially when they're coming in. We, you know, just being morbidly obese, we have difficulty with patients on ventilators. It's it's more challenging. Any immunocompromised state, so diabetes, some children can have deficiencies in their immune system.
Okay, Doc, so we've established the fact you're not a pediatrician. Doc, can you give us an update on the COVID census at GMH?
As of today, we're at 123 total census. We have 48 positive COVID, and of the 48, we have 14 ICU level of care. I believe there are now 10 on ventilators. And I need to double check that ventilator number, but I believe it was 10.
So what's your assessment of the situation at the hospital right now, this morning, Doc?
It's horrible. We have a lot of sick patients. COVID-19 is a very deadly, or SARS-CoV-2 is a very deadly virus. And, what we're seeing on this second wave is likely that the virulence of this virus is more aggressive. When we had the first wave, we didn't have this many patients, and we did have 2 patients that were intubated. And although one of them had a prolonged intubation, was successfully extubated, and both went home. What we're seeing now is everything that we actually read about, where this virus, what it does is that its primary organ is the lungs. So it initially will cause a hypoxemic respiratory failure. Patients are very short of breath. Their oxygen levels will go down. And it does that in multiple ways. One is that it directly damages the lung tissue. And second, it causes a dysregulated immune response. Both can propagate microthrombi or small clots And it's not just in the lung that it can do this. It's wherever these receptors are that these viruses can bind to. So in the intestinal, in the intestines, in the blood vessels, it can propagate little microthrombi and make the blood very thick. They can form a lot of clots. And so in different organ systems, it manifests very differently. In the brain, it causes a stroke. In the heart, it causes a heart attack. In the skin becomes cyanotic, where the fingers turn blue. In the pancreas, it causes pancreatitis. It's a very, very deadly virus. We have challenges when patients come in with comorbidities that are already immunocompromised. So diabetes, right? Having cancer, if you have an underlying malignancy, if you have liver disease. Your liver is a very important organ. It is what makes the proteins of your body. And those proteins are what help regulate the immune system. And it plays a very important role in clotting. And so, I know that there's a lot of comments about, patients coming in and why are they more sick? And it's because likely this virus, and it's going to, over time become more and more virulent. So we are seeing everything. We are seeing heart attacks. We are seeing seizures. We are seeing strokes. We're seeing it all. And then when they're vented for prolonged periods, that by itself, without COVID, causes other issues, nosocomial infections, having a secondary pneumonia on top of that, secondary to multi-drug resistant bacteria that makes it even more challenging to manage these patients. They can go into multi-end organ dysfunction where the kidneys fail, the lungs are absolutely failed, the heart cannot sustain the blood pressure anymore. Very complicated.
Yeah, Doc, I'm just floored by what you're saying, but it really seems like at the onset we thought this was strictly with the lungs. That's all we heard, and now
Absolutely not.
Right.
Absolutely not. It is not just with the lungs. This virus will affect all systems. We've known that. We've just been fortunate in the first wave not to have everybody go through this, but there are multiple patients that were admitted during that first wave that did have multi-system organ failure that we supported, for sure. What we're seeing now is a more aggressive, virulence. I mean, even in the community, people with no medical history, triathletes, down for days.
Doc, there are people out there that are kind of, that may be sick, because it's often been said, we already have a sick population, and people may be scared, like, they're sick, but they just don't want to go to the hospital. Or people don't want to go do their checkups. And so what advice do you have for them? Or are you kind of like, are you guys like in fear that they're so scared they don't want to come to the hospital that, for their chronic conditions? And then it just seems like it's just going to get worse.
I think that there are multiple reasons. One is, they don't even want to come out of their house. Mm-hmm. We had that issue during the first wave where patients weren't even going to their follow-ups because they were too afraid. And then what happened as the first wave had become better controlled, we had less inpatient admissions, we started to see an influx of non-COVID, very sick patients. And so my advice is, please go to your checkups. Please do not run out of medication. Please go and get refills on your medications. If you have COVID, what brings a patient into the emergency department? Remember that most patients, more than 80%, will recover without any hospitalization. They'll have symptoms of fever, body aches, cough, But when you start getting chest pain and shortness of breath, you absolutely should be evaluated by some healthcare provider.
Doc, in discussions we've had.
Dr. Joleen Aguon is correct. All patients need to follow their primary care. We don't want to have another wave after the COVID patient recover, because the non-COVID patient as is important. We don't want to get hit after we recover from this second wave. We don't want to get hit by another wave by non-COVID patients. So we encourage everyone to follow their primary care to get their chronic disease under control.
I think that for us, without COVID, we've always seen an influx of inpatient admissions for influenza, its complications. And so, we are definitely within the flu season. And so it's not just COVID. We have in the history of influenza have had deaths. And so having co-infections with COVID or just influenza admissions is going to continue to task these acute care facilities, Guam Memorial Hospital, GRMC, and Naval.
Doc, in discussion, in discussions we've had with Lillian Posadas, she's repeatedly talked about just how the nurses, doctors, hospital staff, they've also come down with COVID, and just the shortage of, I guess, personnel there as a result. And I mean, GMH has always been short-staffed in the past, and you couple it with what's happening with COVID, so people can just understand what's happening at GMH and the kind of days that these doctors and nurses and people who work at GMH are having. Can you just kind of describe, I guess, just what you go through on a daily basis when you go to work at GMH? Just give people an idea of just how serious it is there.
It's tough. Yeah. I've never seen this hospital in this condition. It's tough to even walk into these wards, because you know that your risk of being exposed is there, but you're the only ones that can actually do it. We go through pep talks of trying to give each other the confidence to spend your entire day taking care of our community with COVID. It's nothing that you've ever seen. We have everybody in full PPE, personal protective equipment. We are working hard to improve the bedside, the aggressiveness of the bedside management, to take away some of the responsibilities that our nurses have. Because I tell you, in the first wave, it was all about really limiting coming into the room. And so our poor nurses really had very large responsibilities. They did everything. They all, and what we found out is that, with this influx and the lungs being affected the way they are, our bedside management needs a multidisciplinary team, which we are building and have been building. We have physical therapists. We now have the medics. We have our couriers. We have our respiratory therapists going to the bedsides to assist our patients in awake proning. So it's one thing to say, you need to turn, you need to prone, you need to face down, you need to turn on your side, you need to stay off your back. And any of the patients that have been admitted to GMH or are still at GMH, they hear this resonating left and right. That is the goal, prone, 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 because these lungs, what happens is it's like the lungs are surrounded by jello. So you have CPAP masks trying to push positive pressure towards those lungs. or high flow nasal cannulas trying to, oxygenate these lungs that the small airways are collapsed. So if you're on your back the entire time, you have continued collapse of the airways. And so, the idea is that getting them off their back, having them face forward or turn on their sides will allow the lungs to open up again. I mean, just that effort. And I tell you, when you tell them to turn, they're not going to turn. You need to help them turn. You can put as many signs up there, but really they need to be assisted. And that takes personnel. And this is what, we put on our nursing staff. So I tell you, the patients are much sicker. They require more at the bedside. And by the time the staff, respiratory therapists, everybody, the physicians walk out, they're done. They're exhausted. We have personnel that are on overtime, excessive overtime. Our docs, they're down. They're down to get down. They're down to help. We have to go and force them to come off shift to take a break. It's absolutely exhausting. And they, who wouldn't be afraid? None of us have signed up to take this risk, every single day. But that's what we face. Saturday was my first day with my children. I have family that are high risk. I deploy to get this done. It is a Monday through Sunday, 24/7 operation, and that's what we do.
Doc, when we made the ask to DOD and we got this team of these nurses and these intensivists and the acute care doctors on, I remember the thinking was, right, that they were going to save the day. But that hasn't happened because of, what you're saying. And we have some very, very sick people.
We have incredibly sick people for a good 7-day stretch. All you heard was code blues. People sitting up. Are you doing better? How's your breathing today? Thumbs up. Doing well. 3 hours later, code blue. Code blue, intubated. How do you plan for that? Clinically, they are responding. Their oxygen level, their requirements are getting better. And then they turn. And then they're seizing. That's what we face. And let me tell you, there was one intensivist, who just started his full shift on Saturday. We have 15 nurses. We have nurses in our staffing that are sick. They cannot be here. They have risk factors. They're burnt out. 15 nurses. We have 123 census. It's not enough. It's, the fact that the EMAT came in, I tell you, I'm so thankful that the governor, the surgeon cell, that GMH, Homeland Security, everybody pulled together to get this team in. But we didn't anticipate that our own staff were going to get sick, How do you plan for that? I tell you, if that didn't happen, this would definitely be extra help. Where we were in March and where we are now are very different. Our census at that time was in the 70s. Just a few days ago, we were at 146. Those are normal hospital numbers. And at that number, we're already stretching our staff. We're pulling case managers off the floor. Everybody that's not at the bedside, we pull. Everybody has to work. Mm-hmm. Everybody gets pulled.
Doc, the 123 you mentioned, is that including non-COVID?
The 123 includes non-COVID. Our COVID census today is 48.
What's the maximum bed capacity at GMH?
I'm gonna defer that question because that maximum capacity is with staff.
Right. Yeah.
So it changes.
Doc,
it doesn't matter if we have a 250 bed capacity. If we only have enough nurses to do 123, then our max capacity is 123 today.
And that's our max then.
And that may change tomorrow. You know what I'm saying?
Yeah.
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 Doc, I interviewed a nurse, Paula, with I know you know she was talking about the use of technology and getting a lot of these COVID patients, the laptops and the things that they need to communicate with their family members. So that being said, I wanted to ask from a patient management point of view, when you have these very sick patients in the hospital going on these tabs, and I don't know if they read the news about people that may be in the room next to them dying from this virus. What's it like to kind of manage those feelings and those thoughts and those very real fears that patients at the hospital have?
I'm sorry. Can you repeat that?
So you know how we've got these COVID positive patients in there with the tabs and the technology. When they read about
Yes.
these COVID-19 deaths happening in the hospital, what's it like to manage the concerns and the fears that they have? Are they in a position to vocalize those things to you guys, and what's the response that you give?
So everybody, all of these patients have fears of dying. Nobody wants this disease. Nobody wants this virus. And it's the staff, talking about, it's really about keeping them informed, letting them know how they're doing, and being very honest about when they're not doing well, anticipating what the next step is so that it's not a surprise. They come in and have been here since August 25th, and 7 days later, their lungs start to take a hit. And just educating them of what the next steps are. They don't ask about dying. They just want to know how they're doing. They want to be informed as much as possible. The challenge of, and this is a system that we're still trying to improve on, is the communication with the family. This is so hard, right? Part of healing is having family at your side. You can't do that here. Being informed, having them there as you try to recover. It's so awful that we can't do that, because that's who we are. That's anywhere, right?
Dr. I wanted to follow up on the DoD medical team, and I know, Dr. Hoa, you've talked about this in the past, about the medical team and how they're only here for 30 days. And GMH, as you said, no one would have anticipated that our own people at GMH would be getting sick. And so what are we going to do when this 30-day deadline comes up? I mean, I don't know if there was any final determinations made that this was going to be extended. Could you guys provide an update? And maybe even what is the plan going forward when these DoD deployed people go home?
I think that from the PAC, we understand that they be here for 30 days, but we understand we're going to ask them to stay longer if possible, because as long as GMH are trying to recruit physician and nursing staff from off island, if we have a plan together, then we hope that they stay longer. I know Lillian was trying to ask them to stay longer, so it's the PAC and the surgeon cell and the governor. But Joleen will have more info on that one.
Thanks, Twa. So same, yeah, we will. We are definitely working hard to bring in other nurses, travelers from private companies. Lillian and the administration is working very hard to try and get them in as soon as possible. We would like to request for an extension so that we have an overlap of the staff.
At this point, does it even matter if to even continue talking about the skilled nursing unit or having these hospital tents outside of GMH? I mean, do we really even need to continue to plan for that if we don't have, as you guys have said, the staff? And as
Yes, absolutely. We need to continue to plan because we want to open that SIF. You know, we want to have more resources. It's better to overplan than to underplan. We don't know, you know, what's going to happen. We don't have a crystal ball to predict what's going to happen in a week. We don't know if these guys are going to get influenza and COVID positive and walk in our doors. So please, overplan. I'm asking to overplan.
did you?
I don't know. I'm just floored by this whole thing. So. Doc,
I was just going to ask, has anybody, any nurses or doctors or anybody quit GMH because of what's happening and the stress is just too tremendous? Are you aware?
The thought of quitting versus actually doing it, I'm sure many have. But if we don't do it, who's going to do it? Who's going to take care of our community? The same hospital, right, whose windows are leaking. And by the way, we're supposed to have this big storm. So guess what? Our ops, our housekeeping staff, our safety department, everybody's going to be running around trying to catch water. You know, I mean, that's what we face. That's our daily. And then you add COVID on top of that. Working here is tough. It is tough. I tell you, if people want to volunteer their time to come and help us out, we're open to it. Physicians, nurses, anybody who wants to help us, we are absolutely open to it because it's so easy to criticize when you're not in it. So I am happy to, you know, I'm sure everybody would be happy to get more help because that's what we need. We need more help. You know, it takes a lot of manpower to get stuff done because we have an old system here.
Dr. Aguon, what keeps you there? You know, when you describe what's the leaking roofs, you haven't seen your children.
It's always been GMH because this is where my family is and this is my community.
so are we looking for someone to go patch the roof? I'm just going to put the call out. Where are my roofers at? If you guys, there's no construction, so let's go work on this roof if that's even possible. Sorry.
Seriously.
Yeah, I mean, I am being serious.
I mean, seriously.
Yeah.
Anything else?
No.
Somebody's asking, what are the requirements to volunteer?
Yeah.
We actually have a volunteers program. I'm really serious about this. We actually have a volunteers program. I'm going to ask our MIS or Don Robinall, who's the head of our MIS division, to see if we can put this information, if it's not there, which it should be, on our website, so that you can see the process. It's not just walking in the door. We actually have to go through a process.
Right.
Dr. Aguon, can you provide any update on this nosocomial infection investigation that Lillian was talking about was underway a couple weeks ago?
I'm going to defer that to Lillian.
Okay.
Thank you, Doc. I would say in closing, but I feel like you've said it all. But is there anything you want to add in closing?
Stay safe. Stay safe, practice your infection control and prevention, wear your mask, wash your hands, and really social distancing as much as possible. And I tell you, it's so hard, right? Because the one thing that keeps us together is when we break bread. It's being at the table and eating as a family. And even that, we can't do. Everything that allows us to enjoy each other, we can't do. You know, so that's my advice. Stay safe.
One quick addition regarding the Guam COVID Alert app. I understand, Dr. Aguon, you were instrumental in and vocal about the importance of downloading this app.
I am all for, you know, any devices that can take the human out of it. So, you know, if we can get a lot of information more efficiently with a lot less manpower, I support that.
Is there any? Okay.
Yeah.
Was there anything else you'd like to add, Dr. Hoa, Dr. Aguon? Senators are going into session today to talk about funding, and GMH obviously is in desperate need of funding. I mean, public health, I know they were cutting their budget. So is there anything else you guys, or any message you guys want to say to our leaders?
Yeah. Give us our budget and approve the CIP, please.
Short and sweet.
Yeah.
Well, maybe not so sweet, but I like it. Short and stern. Dr. Aguon, thank you so much for joining us. Really,
you.
we know you're busy. And,
You know,
yeah.
Yeah,
Dr. Hoa?
the GMH can get.
Yeah, thank you, Doc Hoa, for
Thank
you.
putting us in touch with Dr. Aguon. Doc, we'll just, and flu
Guys.
shot, guys. So you guys want people to get their flu shots, right?
Yeah.
This season, everyone needs to get the flu shot. I tell you, just like Dr. Joleen Aguon said, you don't want to come in there both with influenza and the COVID-19. They can coexist. It's very important that everyone get the flu shot, rather than get the flu. So please see a primary care physician, get the flu shot, especially the children, now that we know that. So please be safe. Again, thank you, Joleen, for coming on. I think everyone learned a lot from you. So she's part of the pack,
you.
and
Right.
that's
yeah.
the hardest working person in Guam the last 6 months. So thank
Yeah,
you
so
so
we'll,
much, Joleen.
you can come on tomorrow
you.
too, Dr. Aguon, if anytime.
Thanks, Dr. Aguon.
Thank you.
Okay, Doc. See you.
Thank you, guys.
Dr.
Be
Hoa.
safe.
Hey, Dr. Hoa, we're not done with you though. Real quick, Dr. Hoa.
Oh, okay.
The PAG, they're meeting tomorrow. Last week, we understand from Dr. There was some discussion on what the chamber was talking about with us last week regarding low risk versus high risk businesses and changing it from essential to non-essential. Can you provide any information on what he was referring to?
As we move forward to on PICO 1 here, the hospitalization would be the key for us to get out to PICO 1. I know that the tracing team are improving. They added number to our tracing team to make it more effective and isolate and trace onto a positive. Our number will be improving. They are improving with the lockdown. It worked. So to move us out of PICO 1 hospitalization, probably the key here. And we will talk to the business group, the Chamber of Commerce, CBB on how to move forward on the PICO 1. So some business, very limited business can be open safely, but we got to move very slowly. So we talk in the PAC a little bit about that. We have not discussed with the governor because we still try to work with the business group to see what can move forward. But our economy need to be open very, very slowly. Again, Dr. Aguon is very cautiously, advises because she's in the PAC also to try to look at every situation, every business carefully. So yeah, they put into a low risk and high risk category for business. So we continue to talk tomorrow. I asked the PAC to come up with a list so we can discuss safely to see if we can open some. Again, it boiled down to our list going up to governor, and governor will decide which one she agreed to move forward with. So it's going to take another week to 2 weeks or so for us to discuss this low risk and high risk business group.
Can you tell us anything else about what's happening with this cluster at this construction workers barracks? Because we have the governor's the public health directive that all construction is supposed to cease, but yet we get a comment from like Joint Region Marianas, and their military construction is going to continue. I'm kind of like, what is going on here?
Yeah, this when they have worker leave in an environment like a dormitory in the barrack, it's always have a risk of infection go rampant over in the barrack. What happened is that in the span of a week or two, when you have a huge amount of infection come out at the construction company, and once we start to see that spread throughout multiple company, because they all work in the same site, because there's some, I guess, subcontractor and all that kind of stuff. So once you see that they have this little small pocket of infection in different company, you start to worry that, hey, if we don't control this and we get this aggressively, we have another surge of COVID positive patient in a cluster. I know that they are in the barrack, they're in the dormitory, but again, some of the small company have people in the local community that live in our community. So if we had to put a stop in this really quick, and we decide that construction needs to be stopped, I'm not quite sure, but the military, they supposed to follow. I mean, there's a huge communication. I'm not sure it's clear within Guam and the military or not, but they gotta understand this construction site on base. I'm very disappointed that they don't follow that. I'm telling you, they have to keep in mind that I know timeline for construction is there, but if they don't help Guam and control infection, they not dealing with the hospitalization. GMH will be dealing with hospitalization.
Yeah.
I can see Dr. Aguon mentioned there. I mean, we are in a very hard situation, and we need the military to actually involve and work with Guam. There's a reason why the governor and the public health put that memo out, because we try to control an infection. And if the workers are getting sick and they need to be hospitalized, they will go to GMH. They don't go to Navy Hospital.
Right.
So the Air Force and Navy need really, really pay attention to what the decision is. I know one of the big company, one of the biggest company in Guam, I talked to them this past weekend, and they voluntarily didn't show up to work and hold off on the work on base because they want to support the governor decision. And I applaud them for doing that, because we all need to be in the same boat. We cannot stay in this peak hole one because of hospitalization all the time. So we need everyone to get help. And I think that there's a lot of communication improvement that they need to do within the military and Guam.
Thank you, Doc.
And again, I'm disappointed that the Admiral and the military did not follow the order, the memo put out by public health. I'm telling you, very disappointed military.
We are too.
Not follow the government advice.
I'm very disappointed, Doc, but I think you hit it on the head.
Need to step up.
Yeah, you hit it on the head, because if these people get sick, they're not going to go to the military hospital, which is why I think they just don't want to listen, because it's going to be our problem. Thank you, Doc. We got to run.
Okay.
Stay safe,
Guys,
Doc.
be
Yeah,
safe, okay?
you too, Doc, and appreciate your time.
Thank you so much.
Okay.
Thank you.
Bye-bye.
Nice stuff. Wash your hands. 803, we're KUAM FM in Hagåtña, Guam. Yeah.
Well.
Ooh, they got their ears tealing by Dr. Hoa. We're going to go in. We're going to say bye to our viewers on KUAM TV first. I don't know what camera I'm looking at.